Halls. He is a CIHR new investigator and Michael Smith Foundation scholar. In 2017, he actually was recommended as one of Canada's top 40 under 40. So he's the young Jackson.
All right, and Liam's going to talk to us about,
Liam's going to talk to us about premature coronary disease.
Great. Okay. Well, thank you so much, Jackie, for the invitation to get to be part of this this great meeting that you put on. I think it's really wonderful the way that you engage the patient community. It's really an exciting meeting to get to be a part of. So I wanted to speak a little bit about one of my areas of interest, which is premature coronary artery disease, and try to make it a little bit relevant to SCAD by focusing on acute myocardial infarction in young women. So when we think about mechanisms of acute myocardial infarction in women, as we've heard, obviously, the bulk of this is traditional atherosclerotic mechanisms of plaque rupture, plaque erosion, but then there's these very important other players that can contribute to non-obstructive mechanisms, including vasospasm, microvascular, and SCAD. I think I'll need to make the SCAD piece of the pie a little bit bigger after the earlier talks. I really look forward to seeing this data when they come out in circulation. I think when we think about acute myocardial infarction in young people, and particularly in young women, it's helpful to put it in the context of what we're seeing overall in terms of rates of myocardial infarction. And of course, as we know, the rates of acute MI and of coronary artery disease in general have actually fallen in the overall population quite dramatically. And this is a publication from the late Jack 2 that's now a few years old, but I think really showed quite dramatically how substantial these rates of decline in acute myocardial infarction have been overall. But this beneficial trend has really not been shared by young people and by young women in particular. And this is one study, an analysis of data from the atherosclerosis risk in communities study, which demonstrated that really over that overlapping period of time, no reduction in rates of acute myocardial infarction hospitalization in young women aged 35 to 54. And if anything, there may have been a slight upward trend over that time period. And that contrast to men, where actually they obviously did have some reduction over that period of time, even in these young men. In addition, when you look at the proportion of all acute myocardial infarction made up by young women, that proportion is actually increasing again from that same study from data from the ERIC cohort. You see that the proportion of all acute myocardial infarction made up by young women was actually there was a significant trend going up from 1995 to 2014, where it increased from 21 up to 31%. We saw actually this data from this paper earlier in Dr. Mulvey's talk, but I just wanted to make a slightly different point, which is from this analysis from Dr. Humphreys, where they looked at rates of acute myocardial infarction in British Columbia. The only group for which there was a statistically significant increase in rates was in young women aged 20 to 55 years. And the rate of increase was small. It only went up by 1.72% per year, but I think still quite remarkable that this is the only population in which in British Columbia there was an increase in rates of myocardial infarction. We recently did a similar analysis focusing on young individuals. So these were men under the age of 55 and women under the age of 50 that were presenting with coronary artery disease based on acute myocardial infarction or a coronary revascularization procedure. And similarly, what we found is this is looking at a period of now more recent from 2000 to 2016, absolutely no trend towards a reduction in rates of atherosclerotic cardiovascular disease in these young women, which again is in sharp contrast to what we're seeing in the overall population. And so these types of observations have really led to myocardial infarction in young women as being described as an unrecognized and unexplained epidemic because of these rising incidence rates. We also know that young women presenting with acute myocardial infarction have really distinct patterns in terms of their comorbidities and risk factors. And so in this sampling from the National Inpatient Sample in the United States, more than 1.4 million individuals, was found in young individuals, 18 to 59, presenting with the first myocardial infarction. Very significant rates of some important risk factors, and interesting also sex differences. So diabetes being present in 34% of women, certainly higher than men, 25%. Similarly, hypertension in 61% of women and 57% of men, and obesity in 23% of women and 16% of men. And very high rates of smoking, 50% in both men and women. Similar analysis here showing again these very high rates of diabetes, hypertension, and obesity in women and men in both the very young age group, 18 to 44 years of age, as well as in the 45 to 59 years of age. From a study that we just recently published, again looking at data from British Columbia from young men and women, so again men under 55, women under 50 presenting with coronary artery disease, again showing very, very high rates of some important risk factors, again with large differences between men and women. So, and what we're showing here is in the population presenting with early coronary disease as compared to comparable age individuals from the general Canadian population using data from Statistics Canada. So diabetes being present in a quarter of females and certainly much, much higher than in men, 15%, and you can compare that to the much lesser rates in the general population of women of a similar age, 3.4%. Hypertension, again, also more common in women, 48.7% compared to 39.8% in men. And smoking, again, really astonishing to me that these, again, are data just looking at the last 16 years, that these rates of smoking are incredibly high, 43% in women compared to 28% in the population average. There's also data about other important risk factors that are for which there's sex differences in young women with acute myocardial infarction compared to men. So this is data from the Virgo study looking at high sensitivity C-reactive protein levels in women and men presenting with a first presentation of acute MI. And again, very significant difference between women and men, suggesting perhaps the presence of a more inflammatory phenotype in women, which I think is interesting in the context of now new therapies targeting inflammation to treat cardiovascular disease. One factor that doesn't seem to account for the difference in rates between acute MI in young men and women is lipid levels. An area I'm very interested in. Again, these are data from the Virgo trial, essentially just showing that in young men and women presenting with first MI, rates of total cholesterol, LDL cholesterol were not significantly different. And in fact, if anything, women had, as one would expect, significantly higher HDL and lower triglycerides. And so there doesn't seem to be an adverse lipid profile that can account for the increasing incidence of acute MI in women. Not shown on the slide is levels of lipoprotein(a), which are another very important risk factor for early myocardial infarction in both men and women, which again does not appear to be different between the sexes. Data from the Genesis Praxis study led by Louise Pilote and colleagues has also taught us about very high rates of non-traditional risk factors in women presenting with premature myocardial infarction. So in this analysis, rates of depression, anxiety, and stress at home were all significantly higher in young women compared to young men presenting with an acute MI. So I think, again, telling us about the important differences in terms of the risk factor profile of women that develop cardiovascular disease at a young age. And I think what's particularly worrisome is when we look at temporal trends of some of these risk factors, what we see is, in fact, the prevalence of some of these risk factors is actually increasing in women. So again, looking at data from British Columbia over the last 16 years, what we see is in very young women under the age of 50 presenting with coronary artery disease, rates of hypertension, diabetes, and obesity actually all significantly increased over that 16-year period. So the rates of these important risk factors not only are very, very high, but they continue to rise, and really speaking to the important opportunity to target more primary prevention by addressing these risk factors at a population level. So not only are the risk factors more common and rates are increasing, but what's also known is that treatment in young women presenting with acute myocardial infarction tend to be less. So from this analysis from J. Bell in Toronto, looking at 23,000 patients in the province of Ontario presenting with an acute coronary syndrome and all treated with an early invasive strategy, rates of undergoing coronary revascularization were significantly less in women, only about 50% in women compared to more than 60% of men actually underwent coronary revascularization. Similarly, rates of other important therapies in the setting of acute myocardial infarction are used less commonly in women. So in this analysis, rates of non-aspirin antiplatelet agents, lipid-lowering agents, as well as coronary revascularization, this is now in the US population, were all significantly less likely to be used in women hospitalized with an acute myocardial infarction at a young age. And similarly, if you break down between presentations with non-ST or ST elevation myocardial infarction, rates of some of the important therapies were used much less likely. And then lastly, what we see is that mortality for young women presenting with an acute MI is actually higher. And so in this analysis, in these different age ranges, women from 30 to 55 years, in virtually every age category, there was a significant trend towards increasing rates of mortality in women presenting with an acute myocardial infarction, whereas for men, that tended not to be the case in most of the age groups. We observed a similar pattern in our analysis, again, of data from British Columbia, looking at young men and women presenting with coronary artery disease, and really found quite a striking increase in, this is now looking at all-cause mortality in women after they've developed cardiovascular disease at a young age. So to summarize, young females with acute myocardial infarction represent a special high-risk population because of the increasing incidence, the higher rates of specific comorbid conditions and risk factors, lower rates of treatment, and the higher rates of both short and long-term mortality. And so I think in that context, the work around understanding more about SCAD is extremely important as one component of this very high-risk population. So I'd just like to recognize some of my coworkers and collaborators